Afrika has recorded 1,366 new COVID-19 cases in the past 24 hours, bringing the total number of laboratory-confirmed cases now to 3.6 million. This represents an 8.1% positivity rate. With these declining figures, is South Africa exiting the fourth wave, and should we be concerned about other variants and waves? Here to update us on the progress on the move in the fight against the COVID-19 pandemic is the vice-chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa. Good evening, Dr. Mzukwa, and thank you very much for your time and joining us tonight here on In Focus. As I speak to you, I'm actually reading a statement coming from the presidency, actually saying the country has exited the fourth wave based on the trajectory of the pandemic and the levels of vaccination in the country, saying that those who test positive with no symptoms do not have to isolate. If you test positive with symptoms, the isolation period has been reduced from 10 to 7 days. Contacts do not have to isolate unless they develop symptoms. I mean, what's the rationale behind these amendments? Firstly, by all means, it's an indication that everybody believes we have now exited the fourth wave. But what is the rationale behind these amendments? Does that mean these things are no longer important? We no longer need them?
Good evening, Thabo, and your viewers. Thanks for having me in your program. Thabo, we still have COVID amongst us. As you correctly put it, we have a positivity rate of 8.1. We have not yet gone out of the woods. We are still in the middle of the pandemic. I do think that we must not get too excited about these numbers and what comes of the national government. We know that there are still people are suffering, and there are still community spread, as you can see, with the positivity rate. So it means if we're still having people dying, it means those people were hospitalized, and that points to some levels of severity in terms of people who are having underlying medical conditions. So it is important that we still maintain some of our measures, pharmaceutical interventions, like your masking and avoiding large crowds and all those things, and putting our mask is still important. I see people now, too relaxed and stuff like that. The problem is you contract COVID-19, you go to your grandparents who may not be vaccinated, by the way, and they contract this virus, and they may risk, they may find themselves getting hospitalized or even dying of this pandemic. So we're still having this in our midst, even though we are entering what we call an endemic stage, but we are still having COVID amongst us. We have to respect that and act accordingly.
Yeah. What's the relationship between an endemic stage and a proportion of people with immunity to COVID-19 now sitting at close to 80%?
Well, the importance of that is that we are having COVID-19. It's not that no longer in that acute phase where we had our hospitalized hospital institutions overpopulated by admitted patients. But it means now we can live with the virus like we are living with HIV. But we need to be careful in terms of noting how we can spread it to other people. So we can now live with this virus in this phase, because most of us are vaccinated, are still getting vaccinated, especially those that are above the age of 60. And I commend government in this regard for offering incentives to those who are going there as over 60 years, 50 years of age, to say that if you go vaccinate, there's a voucher. So I do think that it is encouraging to see most of those people are vulnerable going to getting vaccinated. And I'm sure that if we continue at this trajectory, we are going to defeat this pandemic like we are now. And most of us have been exposed. Now we have what we call natural immunity. So it is giving us hope, but we must continue vaccinating.
Yeah. Some big decisions have been made here, Dr. Mzukwa, one of which is that we are now returning to full-time learning, and the 1 meter for learners in school has been removed. So social distancing in schools has been removed. Now, you just mentioned the issue of getting infected and taking that home to parents who generally are not vaccinated at this particular point, and they are elderly. I mean, what will be the implication of this in the prevention of transmission of the virus? Not observing the 1 meter social distancing regulation?
Well, I think if we still, encourage the young ones to get vaccinated, so that when they get there, even if they do get, they contract the virus, there are, smaller chances of them taking it to their parents, but also encouraging parents and all those who are at risk to vaccinate. But also, even if we take away that 1 meter distance, we still have to put on our masks, we still have to sanitize, making sure that,